looks like we've got I think we've got a decent number here. And again, Shannon sends her apologies because obviously something has come up. So, but luckily I know how to edit now. So we will go ahead and start. So, well, hey everybody, welcome to today's leadership series. Before I get started, I'm going to just have to read out something from our sponsors, the law firm of Hull and Chandler. So Hull and Chandler PA is a client-centered law firm providing legal services to individuals, families, businesses, and nonprofits in Charlotte, North Carolina, and throughout the Carolinas. Our award-winning attorneys help our clients solve real-world problems and provide real-world value. On any given day, you can find Hull and Chandler attorneys helping entrepreneurs start businesses from scratch or counseling them on buying an existing business. Serving as a fractional general counsel to a nonprofit, reviewing contracts and ensuring compliance with regulators. Helping families plan their estates to ensure their loved ones are taken care of after their time on earth is through. Protecting the rights of individuals and families who've been victims in auto accidents, or litigating in court to protect a business who hasn't paid what has been agreed upon in a contract. If you are interested in learning more about how our attorneys can help you solve your real-world problems, visit our website at www.hullandchandler.com and schedule a consultation with one of our award-winning attorneys. The law firm of Hull and Chandler is proud to sponsor the Leadership Series, a program where Hull and Chandler attorney Rocky Cabagna, that's me, interviews local and regional leaders in the nonprofit, private, and public sectors to discuss the real-world interplay of law, business, and social dynamics within the context of our continuously changing times. So I'm your host, I'm Rocky Cabagnot. I help nonprofits stay legally compliant, avoid legal problems, and feel secure with overall legal representation by providing fractional general counsel services and also tailoring legal access to nonprofits via our firm's innovative and quite affordable legal subscription program. As a former executive director of a multi-million-dollar public charity, I designed these legal service programs to go beyond the billable hour to better meet the legal needs of nonprofits and the legal issues they face on a daily basis. I've been serving the nonprofit sector in some form or fashion since I started out as a legal aid attorney out of law school 20 years ago. So anyway, let's get started. So you might be surprised to know that the benefits of maintaining good dental health extend far beyond just your mouth. According to public health experts, your oral health, the health of your teeth and gums, has a major impact on overall health, medical costs, and quality of life. Experts maintain that the significance of the mouth as part of our health is often overlooked and underappreciated. We've also known through our own experiences that our vision of ourselves, how we are seen by others, and even our employment may be influenced by our oral appearance. Many of us who work for employers who provide employment benefits such as retirement accounts also overwhelmingly provide health insurance and, in addition, dental insurance. And public health experts argue that oral health, the health of your teeth and gums, has a major impact on your overall health. Why is dental insurance covered separately from health insurance? Currently, Medicare doesn't cover dental work, but experts have said that good oral health can help fight primarily senior ailments like Alzheimer's disease. If you're like me, maybe you're wondering why your health insurance doesn't cover dental or oral health care if it's so important. Perhaps there's that impression that dentists aren't, quote, real doctors that many lay people have, and that dental work is really more about vanity and not health. To help us unpack the issue of oral health and why dental care is not a luxurious vanity project is Jill Malmgren, Executive Director of America's Tooth Fairy. So welcome Jill to our show.
Well, thank you so much, Rocky. I appreciate the opportunity to talk to everybody.
Or something like that. Because I know by the time people kind of unmute and ready to back unmute, and they get kind of caught in the crossfire there.
So, well,
Go ahead.
I was just saying, thank you so much for this opportunity to participate in the leadership series today. Delighted to be talking with all of you and hopefully get to learn a little bit more about your organizations as well, and maybe create some opportunities for us to work together. As you know, Rocky was saying, I'm Jill Malmgren, the Executive Director for America's Tooth Fairy. And that is a national organization, it's a national nonprofit organization that is based right here in Charlotte. We actually have a ton of programs I'll talk about in a little bit that have benefited Charlotte children and those in the surrounding communities, as well as nationally. To give you a little background on the organization.
How about this? Like, because I always start every show with this one question, and I just want to, because before we get into America's Tooth Fairy, I think all of our guests want to know a little bit more about Jill. And so what I like to always ask, and I always like this question from friend of the show, Pat McDowell, and I always have to throw in a plug for his Your Path to Nonprofit Leadership podcast, is so Jill, what was your path to nonprofit leadership? We want to know a little bit about Jill, and then we'll get to know about, about America's Tooth Fairy.
Sure, great. Well, actually, it was really interesting. I happened to, I previously lived in Southern California, and had the opportunity to join the dental practice, an organization called Cheats and Paquette Dental Practice. It's a world-renowned dental practice led by 3 amazing practitioners.
Now, were you a dentist, or were you working in another sort of para-dentist?
I was fulfilling more of a director of operations type capacity. And at that time, one of the principals of the practice, her name was Dr. Sherilyn Sheets, was in the beginning of developing this organization. So I came on board starting to work with her and as a volunteer. And so I was probably one of the first volunteers for the organization. So it's been really awesome to see it grow and kind of, working with her. And one of the things that was determined in the development of this organization, she had been instrumental in setting up a dental clinic in Inglewood, California, that served about 100,000 kids each year. And one of the issues that they were encountering is, nonprofits, any of those that are in nonprofit on this call know, we're always working with very, very limited resources. And so it became evident that there was an opportunity to create an organization that helped provide the necessary resources for nonprofit dental clinics across the country. So, because they may not have a development director, they may just have, their staff clinicians, and that's it, and administrative staff. So needing some help in identifying opportunities to maybe procure dental equipment or dental supplies. That's a lot of, phone calls for, an admin person to make in that kind of situation, or even looking for funding or educational materials. So this organization was kind of developed as an aggregator of those resources.
Now, was this a nonprofit organization as well, the one in California? Or was this a sort of a practice? Okay.
Yes. So she had established a clinic there, actually dedicated a practice she shared with her father, as well as her home, to serve as a Tooth Fairy cottage. So that was designed to serve as an educational center, which again became a big component of what we do too, because we were able to, really see the value in education. So her home was kind of set up with different rooms to take kids through different aspects and also prepare them for a dental visit. Many of those children, might not have been to the dentist before. Parents and caregivers, there was an established fear of the dentist. Language barriers, things of that nature. So
Jill, it's safe to say that pretty much since you got into the nonprofit, it has been nonprofit and related to access, equitable access to dental care. So you didn't have like a stay in sort of like a Big Sisters, Big Brothers program or something like that. It's been dental work and access to dental work and the nonprofit sector pretty much from day one.
Yeah, so prior to joining that organization in 2006, working in the dental field in 2006, my experience was entrepreneurial as well as very corporate oriented. So very different. And when I began to, work with the practice, I also worked with a nonprofit teaching institute that helped teach dentists how to integrate the clinical microscope into dentistry. So had a little taste of nonprofit foray there, but then just consistently volunteering for this organization. And so served as a volunteer for about 5-6 years, and then relocated to North Carolina, where this organization was based. and ultimately joined the
So
team.
America's Tooth Fairy actually started in the West Coast. So when you say that you're based here in Charlotte, it actually came from the West Coast and it kind of transported to Charlotte, America's Tooth Fairies. Okay.
Yes, yes. So the previous, previous CEO, executive director, she had relocated. She was actually on the East Coast. So kind of the idea was formulated in California, and then ultimately was established in the Carolinas as the home base. And so when I was relocating here, it just seemed like a natural step, being very familiar with the organization, and kind of the players involved, and having developed a real love and passion for helping kids, and as well as an understanding about the access to care issues.
Yeah.
It was a very natural step into the nonprofit world. And certainly something I, never would have guessed years ago I'd end up, kind of in the dentistry field, or nonprofit, but it has, been an amazing journey to really.
So how long has America's Tooth Fairy been in Charlotte?
We've been here, I want to say, well over, oh my gosh, probably over probably about 12, 13 years. And then it was based South Carolina based for a little bit, and then moved to Charlotte shortly thereafter. I want to say probably around 2009 or in that vicinity.
So you've been here. So this is, you're basically a community / at least somewhat regional nonprofit based here in Charlotte. So now that we've got you established here in Charlotte, what sort of, so to the layperson out there, like if you had to describe America's Tooth Fairy, what are you doing in Charlotte and outside of Charlotte?
Sure. Well, basically, as a resource provider, I look at our role as equipping the boots on the ground that are providing, those services, whether it's dental care or distribution of other goods and services to populations in need. So I see our role as really, making sure they have the, educational materials, the training, and the resources to either provide dental care, educate families about the importance of oral health, and how to keep their mouths healthy, as well as making sure that they have those basic resources at home to do so.
Well, so give us an example of sort of like a common partnership. So would you partner with, say, as far as like I have a dentist in my hometown, in Salisbury, and I go to Dr. Huffman, and do you work with private dentists like him, or is it with other nonprofits, or with schools or churches, or kind of all the above?
All of the above. So for example, we serve about 500,000 kids nationally on average. Now COVID obviously impacted those numbers in the previous year, but average about supporting care and education for about 500,000 kids a year. Here in Charlotte, we've had a number of campaigns and programs, and those then they all involve really partnering with other community organizations. So we do support local, your local nonprofit dental clinics with resources, but we also reach out to and connect with organizations, for example, through our Smile Drive campaign, which is basically an oral care product collection drive that is designed, that those products are then distributed to community organizations like your food pantries or schools. A couple of years ago, our goal was to set up hygiene closets in all of the Title I schools as a result of our Smile Drive campaign. We'll work with other organizations providing, different types of medical services or other types of health-related services. But there's really a wide advantage of working with different types of organizations. We work with after-school programs, homeless shelters, and kind of the way we can work with them is, one, of course, making sure they have oral care products to distribute to those that they serve. It also may be involved in, we've done educational presentations, so bringing in the Tooth Fairies, our America's Tooth Fairy team and interns to educate children and their families. And so also providing some training. We've done a number of trainings for Head Start teachers, child care providers, to equip them, providing them with some great educational materials that they can continuously use to talk to their children about the their students about the importance of oral health. So it's really kind of a three-pronged approach to get other communities involved. It's an opportunity for us to equip anyone as oral health educators. We've also worked with local teens. We work with high school students. Anyone can be equipped to do it. And we've set up all of our scripted lessons to make it very easy. So you don't have to be a dentist or a dental hygienist in order to provide this really critical, essential information to children and their families.
So it's safe to say that the mission of America's Tooth Fairy is definitely increasing access to oral health care. Would that be kind of a, and particularly with underserved communities, it sounds like. So, I mean, I wish I had known about you guys when I was running the Community Action Agency. We were, I was running a Head Start program in 5 counties. And so, you know, you always have to do the screening, right, before you have the children come in. And, you know, we're always having to get these MOUs with various different folks to kind of do, you know, a very tight screen, but that dental is one of them, right? And, you know, places like homeless shelters and do you work with any, do you work with any of those like community care type clinics, you know, like those free clinics?
Yes, absolutely. So we will work with, there's really no limit to the type of partner that we'll work with. Our approach is a very collaborative one. So, you know, we see value in what those other nonprofit organizations and community organizations bring to the communities. And we want to be a part of that and help really leverage, you know, all our resources. I mean, I see us, you know, nonprofits are successful if we work together.
Yeah, so you say you bring education, but you also maybe bring other resources. So like, would you be helped, like if I'm running a community care clinic and I need a new x-ray machine, would that be something that America's Tooth Fairy could help out with?
So we will, in that respect, typically we might work with the nonprofit dental clinic in the area, so that because typically they're part of those initiatives. With kind of the one-day clinics, we might partner with providing educational materials and basic oral care resources. If it's something where there is a clinic involved, so we'll support. We support, you know, mobile units, community clinics. You know, standalone clinics, school-based clinics, hospital-based clinics. So we'll work with them to be part of our network, which is free. So it's just, and what that allows them to get access to is say, hey, we heard from these companies, we have these resources available, and we can work with them to identify who's in need of that resource and make sure that it is best utilized.
And so that's cool. And then, and so one thing we had talked about, so one of the things that you definitely do is education and also, I guess, providing toothbrushes and toothpaste and floss and just an education about how to use that. Because I mean, honestly, I don't remember any time to be honest, I don't even remember anyone teaching me that in school. I think that was always kind of, you know, I think it was just assumed that you would learn how to brush your teeth on your own. At least maybe my memory is something there, but as we, you know, kind of in somewhat modern America now, a lot of responsibilities seem to be pushed onto our schools and other type of institutions a lot. And so, do you find America's Tooth Fairy having to sort of fill in the gap in that regard?
Yes, we've definitely had some great opportunities, you know, in working with, like you mentioned, Head Start earlier. So I know in Cabarrus County we did some trainings with the Head Start teachers there to, you know, again, provide that basic information for the kids in need as well as the products. In other areas, we might have worked with schools to set up a toothbrushing program. So kids get access, you know, after many of them get their meals, at least a couple meals at school. So setting up a toothbrushing program so they can brush their teeth before and after. Obviously, COVID's had implications on those types of programs in recent years. And then what we do is, so we can focus on that with those community organizations, and then with the nonprofit dental clinics, there we'll take, you know, again, providing those resources that they need to provide care, so specific dental supplies or products. We have funding opportunities for them. For example, you know, programs that might help support care that isn't covered or expenses that aren't covered to ensure that the child in need gets the treatment they need in order to be healthy.
Okay, so I mean, it sounds like it just sounds like, because I mean, you're still relatively a new organization and getting more folks to know about what America's Tooth Fairy does and to a lot of these community-based organizations is real key. And that's one of the reasons why we were hoping that you could come onto our platform and such. And I'll say this, a plug for our May, I want to say whatever the third or fourth Wednesday in May, we're actually having representatives from the North Carolina Head Start Association on. So you want to maybe join in on that one and plug in. We've got the president and the executive director from the North Carolina Head Start Association to come talk about, early childhood issues. I know, kind of spoiler alert, and it's coming down the line there. But it was only a matter of time before I had to double dip back into like one of my previous lives for content for this show. So I think it's really great to talk about what's going on with America's Tooth Fairy and how you're reaching out and trying to connect to communities about oral health. But I think that maybe the reason why our first conversation that we had prior to airing this was the history of oral health versus overall health. Because I think, a lot of folks are saying, well, that's great, maybe teeth, this is a real important thing, we got to just, the apple a day and a doctor and away and all of that kind of stuff. But we've got we got COVID, we got all this other stuff here. And again, like I said, maybe in my intro, I think there's already kind of a presumption that dental care is just separate from healthcare, because if you work somewhere, usually your dental card is much separate from your health insurance card. So so maybe we can start to explore, because I'd like to know, and maybe some folks here in the audience, would like to know, or maybe they already know, I don't know. Why can't I go to my dentist and hand out my Blue Cross Blue Shield, and why would they look really askance and look at me silly and say, that's not what we're looking for, Rocky?
Well, that is a great question. That is something that, we need to take a look at. It's like, our mouth is the gateway to the body, but at what point did that become separated? And, what I think is most troubling is our body was never up for that, that type of scenario. However, there was a number of other factors that have contributed to that over the years. In the United States, and I will be, kind of paraphrasing, as well as taking some, background information from an interview with Mary Otto on The Atlantic, as well as a book that she had written called Teeth, that really provides an excellent background for, kind of the struggle for oral health in America, the inequalities that exist, and also kind of what led up to that. It is a fascinating read, whether or not you're interested in dentistry. I would highly recommend it. But, essentially, back in the day, the early days, dentists were almost like your barber surgeons, right? Traveling from place to place. It was looked at as a very mechanical type of challenge, doing extractions or repairing teeth. They ultimately served, a number of other, had a number of other skills. For example, Paul Revere was also a, denturist at the time.
Wait, whoa, they didn't teach me that in school. I knew he rode a horse and screamed about, the British and such, but I didn't know he was a dentist. Was Ben Franklin a dentist as well? Because apparently he was everything else under the sun back in that day.
Right. Yeah. So he was a jeweler, but he also made dentures. So you had a number of, individuals that are kind of almost like these barber surgeons, and like doing extractions, but again, a very mechanical approach. Okay. Also kind of setting the profession up to be more a very craftsman-like focused, right? Interesting. Almost a, more trained,
like a carpenter or something like that. So dentists were more seen as, I guess, like a carpenter, a wood maker, it's like iron, I guess I don't know, they didn't have welders back then, but a blacksmith or something like that.
Yes, like we have specialties now in medicine, and that's not unusual, but I think kind of the beginnings of dentistry really, especially in the United States, definitely started with that craftsmanship-like approach. Now, there were two individuals that were essentially self-trained, because there wasn't really formal education for dentists here in the U.S. Chapin Harris and Horace Hayden, they were essentially self-trained, and they had, really come to the realization, after kind of reviewing information from their European counterparts, observing their American colleagues, and really, and also their own experiences, gaining that understanding, like, hey, oral health it impacts the rest of the body, and had ultimately in 1840, approached the University of Maryland. That this is how the story goes. So it is, I guess, a rumored story, but the story goes is that they approached the physicians there at the College of Medicine to integrate a dental course instruction into that, because they believed that, hey, this is something that really needs almost, licensing. They need peer-reviewed scientific journals, and also just a consistent course instruction. At the time, though, however, as the story goes, so just prefacing that, as the story goes, the dentists were not, or the physicians were not interested in that proposal. And it's often referred to in the dental world as this historic rebuff. And it serves as a symbolic event, because what ultimately ended up happening is those two developed their own college of dentistry that was then held in, courses were held in churches and in the professors' homes. But, for such a, interesting event, it ended up really kind of being the, that seed that planted that initial division. So then as time went on, there were other colleges of dentistry and schools of dentistry that were established throughout the country. And, as dentistry really grew and began to be viewed as more of a profession. But while this is happening, there's also a business model that's getting developed, right? So you have, it's taking this very private practice, entrepreneurial type approach, which was differing from how the medical community was getting set up and being established and being viewed. So when insurance came into play, and even though there were those throughout the years that were trying to fight to reintegrate them, now you had almost a marketplace issue. So you had, the organized dentistry for private practitioners that have this business model that's set up to work a certain way. As a result, you also had, for example, dental, the codes for medicine and dentistry are not compatible, right? They develop their own coding system. So that even leads into one, creating some difficulty to integrate the two, but also makes it difficult to do studies that show that and provide more research to show kind of the links between oral health and overall health, because those are now two unique systems that aren't easily integrated to talk to one another. And it just became further established as, insurance came in and, Medicare came in, and that was not considered as a necessity to be covered. It was really just attacking medicine separately. So as you can see, all these things kept building and building, which continue to feed the divide we see now between medicine and dentistry. I think right now there's a lot of folks that are working towards, integrating the two. I know as an organization, we work with nursing students, speech therapy students, different types of groups that are involved in medicine to help, help unite the two, helping, educate, hey, you need, let's get dentists and physicians talking to one another, because right now, even from a patient perspective, your dental records are separate from your medical records. It's unlikely that your physician's able to see and access them, and vice versa. And it really can be, I think, quite challenging. And it's also a missed opportunity for care. So.
Yeah. So, because, obviously, in the last couple of years, there's definitely been a lot of focus, particularly in our politics and in our media, about access to healthcare, whether we should have a universal healthcare system, or to whatever extent policy can make universal healthcare. But obviously way below that is the notion of access or universal or any sort of level of dental care. And I was just maybe you've got some statistics about, I think that we definitely have, I guess really what I kind of find out is there more or less access to dental care versus vis-a-vis healthcare? I guess they should be both the same. But sort of like as our common sort of understanding? Because I'd kind of like to know, like, what is the gap in sort of service, the gap, you know, how many folks are underserved by the dental community?
Well, I'll kind of start off answering that with maybe two statistics right
Okay.
now. Currently, right now, we've got about 49 million Americans that live in DPSAs, which are dental practice shortage areas. That might mean maybe they live in a rural community. For example, we work with a clinic in a county where there's no public transportation, and we support their initiatives. And if anybody needs to go to the dental clinic, they have to walk, you know, if they don't have a car. They're not able to get there. In cities, you encounter that as well. Urban areas that may not have a dental practice, or maybe that clinic is located, you know, very far away. It's hours of bus rides to get to it, assuming that those families are able to get on the bus and have the funds for a bus pass to get there. So I think, and then also something that is important to realize is there's about $1 billion a year that's spent on emergency room visits for dental issues. So when you were talking about kind of like where that gap is, one of the issues is okay, so maybe those individuals can, you know, they have, you know, a toothache or a really severe problem, an abscess issue, they're in pain, they go to that emergency room. Well, dentists by and large are not in the emergency room. There's rarely a dentist on staff that's able to provide them that care. So what happens in that situation is, one, you know, funds are ultimately, they're not getting the care that they really, really need because the hospital, they're not equipped to provide it. So that patient maybe gets an antibiotic, you know, pain relief medicine, and told to go visit their dentist, which they don't have because there's a significant lack of providers that, you know, many providers don't accept Medicaid. So that is a significant issue, or there's low reimbursement rates. So there also is issues, I think, motivations to accept that. You know, running a private practice is expensive, so that can be challenging. Also, that private practice dentist may not be equipped to help patients overcome the challenges and barriers that underserved populations face. I know with us, working with our nonprofit clinics are often used to that, right? They know, oh, we've got to use our mobile unit to bring the service to them, or there needs to be funding for in the GAP program, you know, tends to cover services that aren't covered by Medicaid. And that includes transportation to the appointments, or specialist services that might not be covered, or appliances that might not be covered. That are necessary to complete critical treatment. So those kinds of things, we've really developed a culture where, you know, folks are going to the emergency room, but they're not able to get the care, and certainly nothing against, you know, our friends in medicine, but they don't have the tools and resources there to provide that care for them.
Should hospitals have an in-house dentist?
I mean, we do work with hospital-based dental clinics, which I think is, you know, certainly wonderful. There's a lot of different types of, I guess, strategies to overcoming this issue. You know, finding ways to bring care to those populations is a big one. And there's a number of, and, you know, politics, unfortunately, you know, does play a part. So that can certainly be challenging. Is, you know, trying to find that balance where we create opportunities for providers to be able to provide care, whether it's mid-level provider opportunities, or like I said, you know, supporting more initiatives that allow for nonprofit dental clinics to flourish and thrive and expand their services.
You know, and speaking of law, right? So one of the things that's been kind of developed between them, they call them medical legal partnerships, right? So you have a lawyer who is somewhat stationed in the hospital, and they help, you know, anything that, you know, obviously powers of attorney, mental health care power, a lot of, you know, anything reading this and that, you know, kind of connecting, you know, medical and legal. It makes, I mean, obviously, you know, there's one position is, you know, we need to merge dentistry into the world of medicine, right? But if you're going to continue to have sort of this arguably arbitrary separation between what goes on in your mouth and everything the rest of your body, would be something similar. You know, maybe there needs to be more of an intentional dentistry connection, you know, because I mean, you're talking about $1 billion. I mean, I know nowadays, you know, we've got these $1 trillion like stimulus and infrastructure, which it probably needed, but you know, at the same time, it's like, it's still $1 billion, still $1 billion. And I think that, you know, if hospitals and or medical providers, you know, really thought, well, maybe a good chunk of the folks coming in here are coming in for, you know, toothaches and such. And like you mentioned, you know, yeah, I should give them the shot of antibiotics and then tell them to go to the dentist. But what if you're in Montana, right? You know, and like, you know, it's this big, and, you know, and I'm sure if you live in like whatever the furthest part out, you probably need to go 3 miles to a doctor, and you probably got to go 8 miles to the next dentist. You know, I mean, it's probably some kind of, you know, position like that. And so it does sound like it sounds like there's just a lot going on here. I do think that I mentioned it a couple of times. You mentioned a couple of times about Medicaid, and I think that's one interesting is that Medicare doesn't, you know, allow dental, you know, benefits, even though like obviously maybe they just gave up on older our seniors in their teeth. It's just like America just gave up on the seniors or something like that. But at least at Medicaid, which they need to do something about that. I mean, but because the reason I bring it back to Medicaid is that if I was talking about fast forwarding in our show in May when bringing the Head Start people, if we rewind our show to our second episode, we had Don Jonas on, and we talked about Medicaid transformation. Now it sounds like it's really going to actually happen July 1. And I guess in my understanding is, will this Medicaid transformation where they move from a fee for service, will it have anything to do, and will it have any kind of changes for how low-income families access Medicaid via the dentistry services, or is that something that the Tooth Fairy has a sort of a position on?
Well, we kind of take a strategic approach, and you know, who can we work with to get this job done? We have other counterparts that are you know, working to, you know, lobby for changes that we'll collaborate with to really, you know, move the needle on those issues. We are just, you know, we take a little bit more of a grassroots approach, and how do we get kids, you know, the care they need? And you know, to your point, one of the issues is there's 35 million people that are entitled to Medicaid dental benefits, but only about half of them use it. And, you know, right now, and then that ultimately affects adults. 1 in 5 working adults say they can't afford dental care. You know, 1/3 of Americans don't have dental insurance. And that's
interesting. So, I mean, because, you know, that's an interesting statistic. So even if you are entitled to Medicaid, there seems to be a shortfall in those even with Medicaid going to a dentist. So there seems to be there's a disconnect, because it seems that if I knew I had Medicaid, but maybe that's part of that whole craftsman, you know, whatever separation, that even the folks, you know, because I think there's like a cultural meme of some sort that dentistry is something so separate from medicine, so that even those folks who are, you know, are entitled to receive Medicaid benefits may not necessarily be thinking that Medicaid's going to help pay for their dental visit with it.
That, and I think there's also, you know, a lack of providers or access to those providers. Many of the providers that are out there are inundated. I know one of the clinics that we support, when they were closed due to COVID, they ended up with a patient list of 4,000 people, and that wasn't cleanings. That was like really critical care when they were closed down. So you see kind of how that just builds. There is a you know, huge need and huge demand on our nonprofit dental clinic partners because there is a limited number of providers that you know, do accept those patients or are able to accept them. So I think there's, you know, and again, it does really get back to kind of that marketplace issue and kind of the business structure and strategy. I think there is, you know, we need to work harder to create opportunities to make that make sense, you know, for both the private practitioner and the patient. And, you know, right now we've got, you know, 1 in 5 kids in this country that are suffering from untreated tooth decay. That's, you know, dental care is not a luxury. We tend to look at it as one. And I think too, when you look at individuals that are suffering from, you know, oral disease in some, you know, way, shape or form, it's looked at as almost like a moral failing, oh, you didn't take care of your teeth. But we don't look at other health issues like that. And so I think, again, there's just so many issues that kind of continue to feed
it's almost like oral health has kind of suffered from both sort of the, I guess its history of being sort of like seen as sort of a carpenter or a blacksmith on one end. And then of course, that this notion that, like you said, like sort of a moral, how we view poverty, right? A lot of people view poverty as like, well, you're in poverty because you made some poor choices. So we really shouldn't help you, even though maybe this is where, we've got such a distribution of resources that's so skewed. But no, let's forget about that. You are, you obviously messed up in life. Your parents messed up in life, and that's why you are where you are. And I think when we see somebody with, like unattractive teeth, I don't know what the more, sort of term, I think that maybe you might have an idea that, well, you know what, maybe you didn't brush them, or maybe you didn't do this, or maybe you didn't do that, or something like that. And no one really looks deeper. It's like, well, maybe you've come from the squalors of poverty and you're not exactly in a situation where, you've got a lot of access and you got a lot of education, because at the same time, a lot of people aren't even educated on their heart, about what you need to start eating or not eating, and people maybe not necessarily educated on their teeth. So I would like an opportunity for you to kind of, because I know we mentioned, oral health is healthcare. So maybe what we could, maybe for some of the viewers and those that will be watching this is kind of talk about some of the surprising ways that oral healthcare is almost a gateway, or almost like a canary in the coal mine in some respects. I know that's a whole other weird analogy, but an indicator, like a pre-indicator of some very serious overall body health issues that maybe some people may not know. Like if you've got something in your mouth, that might mean cancer. I mean, something like, let us know what's going on in that arena. Why it's important we should care about our mouths.
Well, oral health is health. Poor oral health is linked to things like endocarditis, cardiovascular disease, pregnancy and birth complications, pneumonia. What we need to realize is that, the mouth is the gateway to our body. It is literally the entry point for our digestive and respiratory systems. And I think what sometimes escapes a lot of us is too, when you have a cavity, we tend to think, oh, it's just a cavity. Tooth decay is an infection. It's an oral infection in the mouth. And, that is just right there. You're essentially got that infection right into a pipeline to our bloodstream. So those bacterial toxins can then get in our bloodstream and then go to our heart and cause problems and issues and inflammation. Certainly, even on a personal story, my husband had thyroid issues, and it was suggested that he might, that he should reach out to his doctor, because our dental hygienist was, just basing on kind of looking at the gums, said, hey, you might want to talk to your doctor, see if you're having any issues with your thyroid. And lo and behold, that was the case. But she was able to determine that. She wasn't diagnosing, but definitely making a suggestion like, hey, something's not right here. And what I loved was that reference. Hey, you need to talk to you might need to talk to your doctor to check this out. So there is really a link. I mean, just having that happen in my own family, and that ended up being life-changing, because there was a lot of issues that he was experiencing that now we had a solution for, right? But that initial prompt to search out that problem and investigate that problem came from our dental office. And, so I think there's a huge opportunity with, encouraging further collaboration. We have, and also I think, oral health, that affects nutrition, right? There are children that, I remember, dealing with kids that they had only would eat like ice cream, because that was the only thing that felt good. Unable to chew food. So just being able to eat, only soft foods. Sleeping, you have kids that are in pain. A child in pain is not able to sleep at night. They're not going to be their best self. And it is really incredible kind of what kids will be able to tolerate, but it negatively impacts their lives in so many ways. There was a young girl that was able to receive care from one of our clinics, and she almost went into shock after the pain was taken away, because she didn't She was 5. She didn't know what it felt like to not have that throbbing pain. And as adults, I mean, it's super, you can't concentrate when you've got that type of issue. So how do you do well in school?
Yeah, because I mean, think about it. If you've got a child and they have like an abscess or something, you know, with their tooth, it's not something that you could theoretically go to the doctor, but the only thing they can really continue to prescribe you is some sort of pain medication, right? But to get to the root, no pun intended, of this thing, you have to have the dentist or some, you know, the dentist professional, the medical person. And yet somehow there's a disconnect because, you know, it seems like that child's, you know, well-being and health is actually corrected by, you know, for the long term by the dentist. It's not the, you know, the antibiotic or whatever painkillers that continue, because if it's something structural there or something, it has to be fixed, you know. But I think it does sound like at some level, you know, there's that sort of disconnect about, you know, what is the healthcare. I'll say this about the Medicaid transformation. I know there's a big focus on social determinants of health, and I think that there and the new fee for service is, I mean, well, it's not. I mean, it used to be fee for, so now they're going to talk about fee for performance, you know. And I think that dentistry is going to have to get, I mean, even social service providers are going to get looked at more from a healthcare, you know, a health well-being perspective, you know, partners that you would never even necessarily think of originally, like Meals on Wheels could be part of your medical, like, you know, because it's getting, you know, fresh food to you, but then bringing it in, you know, looking at it more holistically, that the dentist is going to have to play a role because of that child who is complaining on Medicaid, who's complaining of something in their mouth, but then, and you know, you can only prescribe so much, you know, pain medication, you know, you're going to have to go in there and do something about it, or that problem is just going to, you're going to continually just keep coming back again and again.
Yes, there is, you know, and kind of speaking to that issue, I know in 2007, there's a story of a young boy called Diamante Driver who ultimately died as a result of, you know, lack of access to oral health care due to oral health complications, you know, and an abscess that ultimately led to his demise. And there's no reason we need to see that type of thing again, but it can be very dangerous. So it is very, you know, very much imperative that we, you know, really work to keep our mouths healthy and make sure that these children have what they need to keep their mouths healthy, because ultimately as they grow, you know, I mentioned it impacts their ability to succeed in school. You know, 51 million hours of school are missed each year, you know, due to dental issues, which I then translates to 164 million work hours are missed annually. Dental disease, but that also puts that child at a disadvantage, you know, not only from the health perspective, but then from that socioeconomic perspective.
Oh yeah, like so maybe this is an opportunity, because I know we've talked about, you know, oral health care is healthcare, but I mean, there is some truth to the fact that, you know, having, you know, an attractive, or at least, you know, having at least not having unattractive, you know, oral appearance, you know, I mean, in many respects can open or close, you know, certain doors of opportunity to, and I mean, again, whether that's a right or wrong thing in our society is a different question, but it, you know, the fact of the matter is that studies show, just even your own intuition shows that, you know, people are attracted to attractiveness, right? And I think that unfortunately, you know, I think that's one of those keys. I mean, there's a reason why a lot of those makeover shows that you see on television, for better or worse, a lot of it deals with, you know, some kind of oral health care or oral surgery of some sort, and that person feels so much better, and the crowd feels so much better because of that, what they see. And you know, it's almost more important that the crowd feels so much better, because those are people who might be either implicitly making hiring decisions or other type of networking decisions based upon how, you know, how one's, you know, sort of, you know, oral appearance looks. And so maybe you could talk a little bit about some of the things in that America's Tooth Fairy has found through its research or just studying about what are some of those sort of socioeconomic impacts on folks who, because of poverty, because of transportation, lack of transportation, geography, you don't have that access to quality oral health care. And so now it's almost like the catch-22. I would get this job and get out of poverty, but I need to get these teeth. Well, I'd get these teeth fixed if I could somehow get out of poverty. And then you're sort of, stuck on this like, well, gerbil wheel or something.
It becomes a really vicious cycle. And that's why it's so important to address this early. We have programs that we work with and initiatives where we're working with pregnant women and infant caregivers to really establish the importance of not only that infant's oral health, but mom's oral health too, so that she understands the importance of that. We have with kids, there are kids are 3 times more likely to miss school. Low-income kids 3 times more likely to miss school due to dental programs or due to a dental pain or dental problems. It impacts their self-confidence, getting bullied in school. If that child is afraid to smile, they're not raising their hand to ask that question, it's going to impact their ability to engage with their friends. And what you see now is that continues on. So once that, degradation has started to occur in the mouth, those problems only compound and become more and more expensive to address, which I think, deepens the hole that ultimately that child ends up in, making it very difficult for them to get all the care and treatment that they need to restore their smile. And we've seen it time and time again, supporting initiatives where it really speaks to the fact that it's life-changing care. More than 1 out of 3 low-income adults avoid smiling. Well, why is that? That's because they're ashamed of, their oral condition. And so that right there speaks to that importance. If you're afraid to smile, that's impacting your social life, your engagement with friends, meeting people, as well as your job prospects. It
sounds like that should just be a fundamental human right, that one should just have the right to smile, right? And be able to smile, right? And that has something to do with how your smile should at least somewhat look. I don't know, maybe it's being an idealist, I don't know. But I think that these are really, this is a very important thing to kind of go over. And I think hopefully in today's, show that you've kind of got an idea that dentistry is not just, oral health care is not just about vanity, it's about, it's about health. And it's also about just, the ability for many of our fellow citizens to move out of poverty in some respects, right? If they can get adequate, dental care.
And the opportunity really starts with prevention. Education is the key to prevention,
right?
But we need to provide that coupled with the tools and resources, meaning those oral care products and access to care, in order to continue that good care. Prevention is, saves thousands and thousands.
No, trust me, I'm in law. I think that when somebody comes and sees the folks in our office, it's usually after something has happened, after the contract, either the deal went down or you had to evict somebody or somebody didn't pay or something. But, prevention, and that's sort of what I preach to a lot of my clients is that, you work with me at a smaller rate of head where I can, advise you about this agreement instead of you enter into the agreement, something goes wrong with it, you don't address certain critical issues in the agreement, and now we're in court because of it, And I think prevention is a real is a big thing. I think both in the legal field and in the oral health field and in the health field health field as well. So we've now reached about 5-6 minutes before the end of the hour, and I just kind of want to open it up to some folks to see some familiar names in our audience here. But this is an opportunity to kind of like get an opportunity to ask Jill some questions or just some comments about anything we've talked about or anything that you kind of want to bring up at this time. So don't be shy. You can just either unmute yourself or.
Hey, Rocky. Hey, Jill.
Sarah.
Hi there.
My name is Sarah. I'm also an attorney. I actually work in transactional law, but I had a question more so about like the community outreach stuff you do. And if you ever partner with like when they do cleaning services for low income areas or just, groups of people that kind of work with dentists to kind of set up a clinic where it's a one-day clinic where it's like, come in, we'll do a checkup and cleaning.
Yes, so in that type of scenario, if that group, reaches out to us, we may be able to provide some resources to help support that type of initiative. So if they're, working with a local clinic, obviously we can go through them. But if it's a matter of, hey, perhaps it's providing some educational information for the populations being served there, oral care products to be able to distribute, and then. Also, one of the things I did want to point out to any nonprofits that are on the call, we have opportunities for partnership on our website, and there's also lots of free downloadable resources. So scripted lessons, you may qualify also to be a partner and receive one of our community education kits. That also kind of keeps you on a radar for partnering with, the recipient of, donations that come in through our Smile Drive. I know we work with a number of local organizations that will reach out and to connect with us and say, hey, we're, doing a Kids Day event, do you have toothbrushes, or would you guys be able to help participate in the event and provide, education to the kids there? And then, of course, if there's, those one-day type of clinics, in that respect, we'll connect with who's leading that type of event. To see how we might be able to partner or help support the event. Maybe there's an opportunity to work with those individuals to get them some supplies that are needed. For example, we worked with it was a kind of a drive-through varnish program that one of our clinic partners was doing. So we were able to get varnish to help support that type of event, along with those oral care products. So absolutely, certainly if you're involved with anything like that, reach out. Would love to, find out how we might be able to partner and work together.
Yeah, no, that sounds great. I really appreciate it.
All right, any other questions, comments? Well, I would love to thank everybody for coming on today's show. And again, just remember, America's Tooth Fairy is a 501c3 public charity. And so because any 501c3 public charity is also dependent upon the support of the public, and usually through the form of donations. And so, Jill, could you share with us your what is the website, and if it maybe both orally, verbally, and also maybe in the chat for folks to go and see if they would be willing to give a little support, or at least check out the website. So Jill, maybe you can put the website for America's Tooth Fairy in the chat. Because again, it's an older organization, but you just moved here about 10 years ago, it sounds, and obviously you're doing a lot of great work. But we're here to spread the word about because it's America's Tooth Fairy, right? So let's see if we can get a little bit more out there. I mean, it's not just Charlotte's Tooth Fairy, although we'll be happy to use Charlotte's Tooth Fairy in Charlotte. But
absolutely. So you can check out all of our information at www.americastoothfairy.org. So it's just americastoothfairy.org. And on the top there, you can click on resources to see what available resources we have. If your parents or caregivers, sign up for a newsletter. We send out our Tooth Fairy Tips newsletter with great information for parents and caregivers. And we also have opportunities for our community partners to receive information about available resources that we might have. And also you can check out all the, downloadable activity sheets and lessons and ideas for activities to help educate either your family or those that you might serve about oral health.
All right.